Hello, and thank you for joining us for today's presentation on the future of healthcare in Houston, presented by HCA Houston Healthcare and the Center for Houston's Future. My name is Troy Villarreal, and I am president of HCA Houston Healthcare. Healthcare plays a major role in Houston. The Greater Houston Partnership reports that there are 346,500 healthcare and social assistance jobs in Houston. Not only does this world-class healthcare industry contribute billions to the Houston economy, but our industry also contributes to the care and well-being of our communities. As we have seen, 2020 has been an incredibly challenging year for healthcare. We have been tested physically, emotionally, and spiritually, but we continue to stand strong. We have reevaluated and adjusted our processes and plans, but we see a path forward. The Center for Houston's Future has also updated its research and data to better reflect the changes brought on by the effects of COVID-19 in the healthcare industry. The Center's ability to quickly pivot and capture this data has made this the first healthcare report of its kind. This information will be invaluable in telling the story of health and healthcare in the Houston region. As the chairperson of the Greater Houston Partnership's Healthcare Committee, I am proud to have played a part in bringing this report to fruition. This report is important for the health of our city, and I hope it will bring our business community together to arrive at new solutions to the issues that face us all. Thank you again for your attendance at this virtual event, and I hope you will find the information interesting, useful, and thought-provoking.
Hello, and thank you for joining us today. I'm Stephen Scarborough with Center for Houston's Future, and I'm the lead author of the report we're releasing today. I'm excited to share some of the key highlights from our work. Center for Houston's Future is a nonprofit focused on making our region a top global community in which to work and thrive. We bring business, government, and community stakeholders together to engage in fact-based strategic planning and collaboration on issues of great importance to the Houston region. To that end, we launched an initiative with the support of HCA Houston Healthcare last year to assess how the region's healthcare system is faring across multiple dimensions and how rapid changes in technology and in the delivery of and access to care will affect our community from economic and workforce perspectives. Over the past year, we interviewed about 50 healthcare experts throughout the region and across the country and prepared a report intended for release in March, but life had other plans. We spent the past few months revising our work to include COVID-19. Ahead, we plan to convene community outreach events and develop a healthcare agenda for business leaders to address key challenges and opportunities raised in our report. First, I'd like to share with you points from the first half of our report, which profiles how we're doing in addressing the health and medical needs of area residents. The story of healthcare in Houston is anything but simple. It's full of contradictions. The healthcare sector is the employment engine of our economy, but doesn't commensurately contribute to GDP. We have excellent hospitals, but many cannot access them. As we've seen with the pandemic, healthcare workers are essential for our region's health and economy, but we don't have a well-developed pipeline for training the healthcare workers we need. In this dual story of health in Houston, we have some of the nation's premier hospitals and universities. Yet, we lead the nation in the rate of uninsured residents, resulting in a negative feedback loop between rising healthcare costs and uninsured individuals. While we see the uninsured rate in our region has declined in recent years, we still perform poorly compared to the nation at large, 18% uninsured here versus 10% nationally. Our child uninsured rate is twice that of the nation at large. It should come as no surprise then that Houston residents experience worse healthcare outcomes than in many other parts of the country. Pictured here is what would have to happen to bring Houston in line with the national average when it comes to health. Some points to take away include, we need to better address the prevalence of diabetes and obesity. Many of our residents are not accessing health care, and we need more primary care providers. We're becoming increasingly aware our health is affected by more than just the health care we receive. To improve our population's health, we also need to recognize the role circumstances and environment play in health. These social determinants of health include everything from socioeconomic status to the state of the physical environment. It's easy to imagine how being a child in poverty, 1 in 5 of all our kids, or being food insecure, 16% of the population, or being mired in medical debt collection, 17% of all households, each play a role in negatively affecting one's health. Many of these social determinants help explain why we have the significant health disparities in Houston across class, racial, and ethnic lines. Something that's absolutely clear as we've seen poor and minority communities disproportionately impacted by COVID-19. Switching gears, our report also looks at not just the health of Houston residents, but the health of Houston's healthcare sector. When we look at it from an economic standpoint, the first thing that stands out is how healthcare has been the dominant job growth engine in Houston for a long time. With roughly 350,000 workers pre-pandemic, it is the largest employment sector in our economy, and it's still also the fastest growing one. When you look at how jobs are growing in healthcare, a rate of 2.8% annually, that's 75% greater than job growth for the region in general. CHF projects from 2019 to 2036, 1 in every 4 jobs added in the region will be in healthcare. As the sector has rapidly hired new workers, its contributions to our overall economy have grown. While regional GDP grew 18% from 2008 to 2019, growth in GDP from the healthcare and social assistance sector grew by 53% over that same time period. One of the key findings in the report, however, is that the GDP impact of the healthcare sector is not in line with its level of employment. For example, healthcare accounts for 12% of the region's employment, but just 5.4% of GDP. For comparison, Houston's energy sector holds about the same GDP share, 6%, but has about 1/5 the employees that healthcare does. To better ensure Houston's future prosperity, we should both make sure the healthcare sector is not only our region's job growth engine, but also its economic output engine as well. One option is to accelerate development of our life sciences sector. We profile many of the ongoing efforts to accelerate Houston's life sciences hub, like the ION and TMCX, but more work is needed. We also need to ensure we have enough healthcare workers as our population grows in number and age. In countless interviews over the past year, we heard subject matter experts express concern about their ability to attract enough nurses, medical techs, and specialist physicians. One HR director at a major hospital in Houston told me to meet staffing needs for her organization, she travels to the Philippines to hire nurses 6 years in advance. There are promising developments like the creation of University of Houston's new medical school, but there are worrying signs too that our capacity to develop the workforce we need isn't where it needs to be. For example, we found that since 2008, the number of registered nurses in Houston grew by 31%, 53,000, but the number of college nursing instructors in the region actually decreased by 17%. Our report also details many of the key emerging trends we expect will change how healthcare is accessed and delivered over the next decade and a half. For example, we expect a new emphasis on health, not just healthcare, that will increasingly recognize social determinants of health. Another key trend is the whole picture approach, which involves creating a more integrated healthcare delivery system that enlists people like social workers and teachers outside of traditional healthcare worker roles. The adoption of value-based care, a system in which medical payments are linked to the quality of care provided, is highly probable going forward. Implementation of this model is widely considered to be an essential step in controlling rising healthcare costs. It pays less for volume and more for value, and should shift providers' focus from delivering care to promoting health. By 2036, we expect a more consumer-centered model in which patients are more active in their health decisions. As technology allows for more individualized diagnoses of health problems, new kinds of services that are more precise and tailored to the specific patient will also emerge. AI has the vast potential to reshape the healthcare workforce and change how healthcare is delivered. Soon, AI could perform data-based work, and human workers could transition into roles that interpret, give advice based on, and integrate the resulting information into care plans and operations. Our report includes modeling work conducted by the Center in which we project how changes in workforce and technology use in Greater Houston's healthcare sector could affect its future by 2036. We identified 4 scenarios looking at employment and regional GDP and how they would vary across each case. Our baseline scenario, a projection stemming from historical trends, showed that by 2036, the healthcare sector's contribution to regional GDP would grow 104%, or $25 billion. In our labor shortage scenario, we looked at the economic impact if the industry fails to develop a pipeline to meet workforce needs and experiences a severe shortage of labor. This case leads to GDP growth of just 18.4 billion, 29% less than the baseline scenario. Our rapid technology adoption scenario considered how expediting the adoption of new technologies would play out. Here, aggressively using AI, machine learning techniques, telemedicine, and automation will make providing care more cost-effective. This scenario yielded an additional GDP contribution virtually as the same as in the base case, with gains in productivity being offset by less growth in employment. Lastly, our thriving life sciences scenario yielded the greatest GDP gains out of all the scenarios, an addition of 36 billion in GDP, 51% over the baseline case. Given that the Houston region's overall 2018 GDP was 445 billion, the economic effect of the life sciences scenario would be equivalent to growing today's regional economy by 9%. CHF conducted 2 surveys of human resource directors to assess the business community's view on healthcare issues, one in January 2020 and the second in October and September of this year, to assess changes from the pandemic. Our surveys showed strong support among employers for exploring new models that constrain costs and improve quality. I'll share just a couple of charts detailing what we learned. When asked how their perspective on expanding insurance coverage in Texas has changed given the events over the past year, 59% of those surveyed indicated the pandemic has made them more likely to support an expansion of Medicaid in Texas. Moreover, 3/4 of respondents agreed the pandemic presents an opportunity for addressing existing racial and socioeconomic gaps in accessing healthcare. The pandemic has radically altered employers' projections for increases in providing healthcare coverage and how that will increase in the coming years. When we surveyed regional employers in January, 6 in 10 respondents expected overall healthcare costs to rise by less than 10% over the next 5 years. 9 months later, that figure is flipped, with 65% of respondents predicting a more than 10% average increase in their healthcare costs over the same period. A strong consensus of survey participants agreed that the pandemic will have a significant or major impact across the entire spectrum of our healthcare system, from finance to technology to insurance coverage and more. Asked to predict which areas of the healthcare system will be most affected by the pandemic going forward, respondents identified changes in healthcare delivery, cost reimbursement, and the priority placed on health equity as the 3 most likely areas that the pandemic will most impact. Lastly, we couldn't talk about healthcare without addressing the pandemic. Our COVID-19 section in the report details steps we should take to make our health system more resilient. These include raising the priority on addressing health equity, reducing the number of uninsured individuals in our region would improve our pandemic response. Adopting non-traditional models of healthcare should strengthen the ability of the region's healthcare sector to weather a crisis. Over the past 6 months, the current model has severely distressed hospitals and physician practices as their revenues collapsed and significant layoffs occurred across the healthcare sector. Alternatives, such as a capitated or value-based care model, could help transfer financial risk from providers to payers. Adopting a greater focus on social determinants of health will improve health outcomes. It is likely that the health outcomes for those stricken with the novel coronavirus would have been significantly better if the region increased investment, not just in public health, but also in initiatives to strengthen communities and the physical environment. A coordinated public health response requires reliable, standardized data. The ability to provide timely information to the public about risk levels is central to combating the novel coronavirus. The region still lacks the formal infrastructure, however, to provide reliable, standardized data amalgamated across different providers and hospitals in the region. Clear and consistent messaging, established guidelines, and protocols and a shared strategic plan are critical pillars of the pandemic response. All these steps require effective coordination among the region's hospital systems and health nonprofits. This is no easy task. Meaningful progress and collaboration throughout the healthcare sector will require leadership from the region's business community. Thank you, and I encourage you to read the full report on our website at futurehouston.org.
Good afternoon. I'm Dr. Edmund Jackson, Chief Data Officer at HCA Healthcare, and I'm going to be the moderator for today's discussion on the future of healthcare in the Houston region. As we've already heard, healthcare plays a major role in Houston, both in terms of its contribution to the economy, but also the well-being of our region. So I'm pleased to have some of the community's healthcare thought leaders from the private sector, the nonprofit world, from government, and from academia to share their ideas and spark what we hope will be the beginning of an extended community-wide discussion on these issues. As we begin our discussion today, just a note to please type your questions into the chat box next to the video screen on your browser, and I'll integrate them into the questions during the discussion. We also have time for Q&A towards the end of the discussion. To start, I'd like to provide a quick introduction to each of our panel members, and then I'll let them talk more about their professional backgrounds and work as we begin our discussion. Firstly, I'd like to introduce my colleague, Dr. Mushtaba Ali Khan. Dr. Ali Khan is the Chief Medical Officer for HCA Houston Healthcare, where he's responsible for 16 hospitals, 13 in the Houston region. During his career, Dr. Ali Khan has worked at the intersection of patient care and technology and has a very deep understanding of how information technology can advance patient care. Next, we have Dr. Faith Foreman Hayes, who is the Assistant Director of the City of Houston's Department of Health and Human Services. As a seasoned public health practitioner and academician with more than 20 years of community and coalition building experience, Dr. Foreman Hayes has focused on helping communities become healthier places to live, work, and learn. Next, I'd like to introduce Amanda McMillian, who was recently appointed as President and CEO of United Way of Greater Houston after serving as Executive Vice President and General Counsel for Anadarko Petroleum Corporation until August 2019. At United Way, Amanda is working to implement its new second century vision, which focuses on the financial well-being of the working poor. Our final panelist is Dr. Chauncey Woodard, who is Director of the Humana Integrated Health System Science Institute at the University of Houston College of Medicine. At the University of Houston New Medical School, Dr. Woodard focuses her research on understanding ethnically diverse patients and the socio-economic factors that influence health outcomes. Welcome, everybody. I'm looking forward to the conversation. To frame that up, have you heard from Stephen Scarborough, who was at the report's primary author at the Center for Houston's Future? The report looks at healthcare in Houston from two distinct angles. First, the report considers healthcare as an industry sector and describes its impact on the Houston economy in terms of job growth and GDP. The report also views health as an essential aspect of the community's well-being. Our panel discussion today will consider both of these issues and their intersections. So we have about 45 minutes for a discussion of the Center's report, so let's dive right in. First, I'd like to discuss what each of you see as the major ongoing healthcare issues confronting the Houston region. We'll talk about COVID-19 in a moment, so let's leave that out of the conversation for now. Let's just see what you think is the community's largest healthcare issues and the role your organization plays in addressing them. So I'll start with Dr. Foreman Hayes. What are your thoughts here?
Thank you, Dr. Jackson. Definitely from a public health perspective, I think some of the critical issues are access to care, access to the prevention and early detection of chronic diseases, so that when people do present to hospital systems, they are not at their sickest, and also having to use, for example, emergency departments to manage things that are really chronic and not acute, and so thereby, kind of clogging up the system for those who might need that urgent or emergent care. So I think from a public health perspective, we know that people still lack access, and I want to say that even if you have insurance, insurance does not equal access. It improves it. And in Texas, we know that we are the state with the highest uninsured population, and that is evident even more so. And we'll talk about COVID later, but it's definitely risen since COVID-19. So access is a major issue, and the early detection of chronic illness should be on number one on my list.
I agree. Dr. Woodard, how would you respond to that?
Yeah, I would just follow up in that same vein. I really feel like access to care is a huge issue here in our community. And As we heard highlighted in the report, there's a real dichotomy here in Houston where we have one of the finest medical centers in the world, and yet we're in a state where we have the highest number of uninsured individuals. And so that poses tremendous challenges to access to care. I think importantly, when we think about access to care, we have to think about ways and solutions to solving that problem. And at the University of Houston Medical School, one of the things that we are passionate about is recruiting a diverse group of students who have a propensity for primary care, which we know is so important and when we're thinking about prevention and thinking about population health. And then training those students to be prepared to work with underserved communities, and not only in the clinical setting, but also in the communities where individuals live, so that they are comfortable with and confident in helping individuals to address social determinants of health, which we know play a huge role in health outcomes, even more so than clinical care.
Mm-hmm. Yeah, so primary care, community access, big topics. Dr. Ali Khan, from the provider perspective, what do you think is the major challenge facing the region?
All right, I was not muted. I mean, I was muted. So as a clinician at heart, I really feel that all key things that when we look at the biggest causes of healthcare issues, we go down to acute or chronic. And with acute issues such as heart disease, stroke, sepsis, that's where we as a hospital system, HCA Houston Healthcare, really shines, right? Our focus is dedicated, and our mission says that above all else, we're committed to the care and improvement of human life. We really want to be able to provide. We're located within the community where the disparities of healthcare are, where there are a lot of uninsured patient populations, and we want to be able to equalize those disparities. Also, it relates to the chronic diseases that we face as well, such as diabetes, high blood pressure, obesity. That's prevalent within our communities. And how do we improve the social determinants of health that were mentioned before? Utilizing different strategies to improve preventive care. Our collaboration with University of Houston, with the Medical College of Medicine that's been stood up this past year, and to be able to train new physicians who are dedicated to primary care and to be able to be the front line. We are also have multiple different types of residency programs, GME programs within multiple facilities, where we can train doctors within our communities to be able to provide excellent care to the communities they serve.
Thank you, Dr. Ali Khan. Lastly, Amanda McMillian, what are your perspectives on the greatest challenges facing Houston?
Thanks, Dr. Jackson. Well, one of the things we look at in terms of the data we review when we think about where we want to make investments in our community and ensure access first to basic needs, and then hopefully a path for longer term financial stability. One of the things we turn to is the data we have from our Texas United Way helpline, otherwise known as 211, which operates 24/7, and it's kind of a sounding board for basic needs across the community. And as we look at that and we look at how we're going to be investing in programs going forward, there are a few things. Obviously, social determinants of health is a significant factor, right? Those are the things that largely determine a person's health at the end of the day. So we are, and again, I know we're going to talk about COVID later, but it's hard to divorce that from this right now. The increase in needs we have seen for very basic things like food instability, keeping people housed, those needs have increased dramatically this year. And we, last year we made over 1.3 million connections through 211, connecting people to help. We're already well over 1.1 million connections for the year. And when you look at the needs we're seeing right now, we are seeing them primarily in housing stability, food instability, obviously, healthcare needs related to COVID and otherwise. But really, I think we're kind of at crisis level around those basic needs. And if we can't address those, then we're going to continue to have longer term issues. And there is a point at which our system and our nonprofit community, we can scale to a certain extent to help address those needs, and we can invest in service deserts, and we can make sure we're engaged with the communities that we're serving. But there is a point at which that's not going to be sufficient in the current environment.
Yeah, so if I were to try to summarize, it really comes down to access to those basic fundamentals: primary care, housing, food, stability. And so, the services are there, but how do we enable people not to be in crisis, and how do we enable them to have access to that? I think that's really come into sharper focus than ever with COVID, as you were saying, Amanda. Some of these topics really have been around for a while, but COVID has truly highlighted them. Back to you straight away, Amanda. How would you rate Houston's response to this the pandemic?
Well, I'll say a few things now that I think everyone on this panel knows, and probably many of the participants listening in today know, but certainly communities of color across the greater Houston region were unmistakably, hugely disproportionately impacted by COVID. Mm. And there are many reasons for that. There's historic lack of access to health care. There are higher rates of uninsurance. Again, over a fifth of residents in Harris County are not insured. And there are higher levels of unemployment and higher levels of employment today in essential worker positions as well. So you've got more people of color on the front lines trying to protect our community and taking on additional risks for everyone else across the region. So I think that's definitely increased demand for services we haven't seen before. And one of the things we are seeing is that we're definitely seeing people who have never had to ask for help before coming and seeking assistance through either directly through 211 or through several of our agency partners.
Yes, it's definitely growing. Dr. Foreman-Hayes, I see you nodding. What would you add to that?
I think Amanda's just definitely so on point. COVID has really, I think, lifted the veil. Health disparities are always with us, but it's in time of a crisis, whether it's a pandemic or a flood in Houston, where we see those disparities amplify. And I think as a public health department, we certainly saw and are seeing the same thing. We've had to meet the needs of Houston, and as a health department, we are the first responders front line, especially for COVID, because we were the first to set up testing and a variety of the other services, trying to make sense of everything. So I would agree with Amanda that we are seeing people who would never have had to seek out public services and support having to do that, and not for a short period of time, but we're 6-7 months into a pandemic here, and we don't see the end in sight, really. So I would agree. I think health amplify and are amplified when you have a crisis. And I think the difference is usually those most at risk and marginalized are the face of it. And you may not have the same level of response that you would have when it's the usual communities that are affected. But now that other communities are being affected, I think we've seen more resources, for some of these basic needs that we haven't had before in the Houston community. Thankfully, I think as a health department, we were able to stand up very quickly because we're used to disasters. Certainly not a COVID-19, but we are used to responding. And so we were able to, gather data, set up surveillance systems really quickly. But the need is still there, and people are still hurting. And I would agree with Amanda about those that are having to go to work. People are going to work positive because they cannot afford to lose a check. They are battling COVID in the home with other people. So we have a real problem in many of our communities where people can't even isolate. They can't isolate because they're living in multi-generational households. So, I could go all day on COVID, so let's go to someone else, because I think health disparities have really been, the veil has been lifted.
Truly. I mean, it's what COVID has highlighted is the extreme interconnectedness between all of these topics in one shared experience. It's quite something. Dr. Woodard, how do we learn from this? What have you seen? How do we react?
Yeah, well, I would just reflect the stories that we've heard already about the impact of COVID on our communities. It's certainly what we're seeing. I practice not only now in a safety net facility, but it's a safety net facility that focuses on individuals who also have high levels of comorbid mental health conditions. And the majority of those individuals are also from communities of color. So when we think about that particular community, we've seen them struggle with all of the basic needs that we've heard about. We've also seen them struggle to even have access to testing, right? Because they don't live in a particular area or they don't have transportation to a particular area. So when we talk about the city's response, I think that our city and county have done an admirable job. I think we learn from these sorts of crises, whether it's COVID or a flood, but I think there's so much more to do. And I think that some of the efforts of the city have been hampered in some ways because we haven't had a consistent state or national message that's helped us to implement policies that can make a difference here locally. So I think it's important to think about all of these communities that are suffering disproportionately. And even within those communities, they're not monolithic. There are even groups that are suffering at greater rates. And so I think it's important for us to think about that and to also really step back and think about the lessons we've learned. And one of the big ones we've learned is that we need more funding to stand up our public health infrastructure so that we can respond even more quickly. And we need multi-sector partnerships. So we see that represented here on this panel, but we need groups from all different sectors working together to help meet these really significant challenges that we faced.
That's exactly right. One of our observations, the focusing and the consistency of messaging is so critical in this time, and that's been something that we could definitely learn doing better about. Dr. Ali Khan, you're on the provider side here, taking care of patients with COVID. How would you reflect on the experience so far?
So Edmund, if you look at it, right, this has been a generational pandemic. None of us have experienced something like this. So, I mean, are there opportunities to improve? I definitely think there's opportunities to improve, but I think there's a lot of lessons that we've been able to learn. One of the greatest things that we've been able to do is with other health systems like Memorial Hermann and Methodist, as well as local health authorities with the Department of Health or Harris Health, we've been able to work and collaborate. And I think the three key things that we've been able to do that we weren't doing before. We were able to communicate, we're able to collaborate and coordinate delivery of care, to be able to deliver care to patients such as the ones that we mentioned before, uninsured patients that didn't have access, to be able to have drive-through testing. All of these things that we learned very rapidly during the pandemic. At HCA, which is 184 hospitals, but here in HCA Houston Healthcare, we have 13 facilities. And during this time, we were focused on what the report highlights, right? Basically enhancing quality, improving access, as well as reducing costs. And I think that was our key focus consistently in ensuring patient safety during the process, because we were rapidly learning new protocols and processes about COVID, CDC guidelines that needed to be implemented. How do we disseminate that into our hospitals? How do we get that integrated and hardwired rapidly to protect and to test our patients and get the care that they need? So I think during the pandemic, yes, it unveiled a lot of disparities. It unveiled, we've been looking at HCA in general has treated well over 60,000 patients. We've treated within our division, 17 hospitals have treated well over 10,000 patients. And we've noticed disparities within, race or gender and so on and so forth. But we've been able to also assess what could we have done better? How could we deliver care in a much more efficient and effective manner? And back to those 3 points, improving quality, leveraging AI and the tools that we've leveraged from HCA National to optimize ventilator treatments, or making sure we're assessing sepsis patients appropriately. So yes, opportunities to improve definitely, but a lot that we've learned, and hopefully we'll use these lessons learned to improve healthcare for everyone.
Yes, I'd mirror that. The experience is necessity being the mother of all inventions. And we've been through an extremely painful experience together, but we've learned a lot and we've acted a lot. I think every one of us is doing things in a different way than when we started all of this. And that's in this sort of the acute phase. The question now, if we focus on the report's longer-term perspective, new models of reimbursement, new practices, new workflows, new technology, how do we take this? How do we reflect on Houston's role in those aspects of healthcare on a longer-term basis? What do we learn from this? How do we change moving forward? Dr. Woodard, would you like to lead out on that one?
Sure, absolutely. So I think one of the important things that we've learned is thinking about our patients as complete and whole individuals and thinking about all of the needs that they face and how we can best address those. And so one of the things that we are studying at the Humana Institute is how to advance and implement more value-based care models, and how using those sorts of models and reimbursing in that way allows us to improve the quality of care for our patients and improve their health outcomes by addressing not only their needs in a clinical setting, but also more broadly thinking about a population health level and how we're addressing the needs that they have at home. And one of the other things that it has allowed us to do is really think, as we've talked here about the importance of data and data sharing, to really use data to target resources in a way that's meaningful. So one example of that is using data that's collected about health-related social needs. And so we were able to take that data and identify individuals here in Houston who were community-dwelling seniors experiencing loneliness or severe loneliness, and link them with our University of Houston students to help mitigate not only the loneliness that the seniors were feeling, but also loneliness that we saw in college-age students as well. And those students were able to direct them to the needed resources that we've heard about, as well as provide companionship. And from that, we saw improvements in loneliness, improvements in access to necessary resources, and improvements in physical and mental health. So I think thinking about how we can use data and use that to direct resources in a meaningful way to the communities that are in most need is another important lesson that has come and an opportunity that we've seen because of COVID-19.
Yeah, the difficulty yet the potential of sharing, the difficulty but the potential of sharing data in healthcare is something, again, that's come to light in all of this, because we all have the same mission, yet sharing deep data has been something that's very difficult to do historically, and that's a big thing for the future. Back to you, Dr. Foreman-Hayes. Well, what do we learn? What are the new opportunities for us on a longer term perspective to take what we've experienced and do better?
Right. So I think, just to echo on what Dr. Woodard said, I think that data is so important. And your point about data sharing, I think we got to get better at that in Houston and even in the state. To get data, we need to make sure futuristically and long term, in the shorter long term, rather than later, that we have systems that talk to one another, that are speaking the same language, so that even if we're sharing data, we don't have to reprocess the data. We're able to use the data in a way where we can make real-time decisions. And so I think investments in systems, certainly an investment in that collaboration that Dr. Ali Khan talked about, so that when you come to the table, we all realize that we do have that shared vision. So let's get past that and let's move quickly, because as we've seen with COVID, we have to make quick decisions, and people in authority have to make quick decisions. And so we need to use that data to make those types of decisions from a policy standpoint, from a practice standpoint. So I say getting systems that talk to one another, speaking the same language, that we're all, investing in those systems. It's certainly going to take a public-private, investment, because public resources, we don't always have the resources that we need to have the best and most sophisticated systems. So, being able to share that cost to get the systems that we need, so that we can use the data in real time to make real decisions that impact, the Houston community. So, that's one area.
That's a strong area. Dr. Ali Khan, if you think out like 5 years from now, what do you see happening in this space as new models, new reimbursement methods come to bear? How does this play out in Houston?
Excellent question, Edmund. So I want to go back to actually those 3 points, right? The triple aim of the study that was published is improving quality, improving access, as well as reducing costs. because that's the foundation. If we don't address those, now we're going to be impacted for the future. So really with you leveraging the data, especially we've been, like I was saying, we've treated well over 60,000 patients. We have a lot of data that we're able to look at. What could we have done differently? We've built systems that are now like patients who, 30% of the patients who were being admitted to the hospitals were going to the ICU. So could we have done something earlier on? Could we have given, certain other treatments to prevent admission into the ICU? But once they do get into the ICU, about 60% of those patients get ventilated. And so, we've implemented tools and utilizing artificial intelligence and other, neat data science tools are able to assess this patient who's now ventilated, is he appropriately ventilated? Do we need to adjust and make sure they're not, because the longer the patients are ventilated, it can lead to untoward effects, it can lead to complications, potentially even death. So how do we reduce vent days? How do we reduce days within the ICU? And that leads to the third aim of the study, which is to reduce costs, because this has to be sustainable for the long run. COVID has really strained all of us. Our resources, from PPE and from many different dimensions. We've had to be able to, make sure we tighten our costs, tighten our strategies going forward, but look at and leverage new technologies to be able to improve the care we deliver to our patients.
And that's the trick of it, truly. So Amanda, back to you. There was a great question raised in the chat over here saying, what can the average citizen do? If we look at the background of funding in particular, Houston and Texas are home to the highest percentage of uninsured residents and the highest number of uninsured children. Employer-provider health insurance is covering fewer Houstonians, as many have lost their jobs, and as people have been furloughed and COVID continues to bite economically, that trend is likely to continue. Texas also has long declined Medicaid expansion, and the costs of providing healthcare continue to rise. What are the options to address this? What can the average person, average Houstonian do to contribute here?
That's a great question. There's more that you can do than you think, so that's the good news. From a United Way perspective, and I'm going to tie a couple of things together. One of the things we were already looking at pre-COVID related to our Second Century Vision was a lot of the same themes we've been discussing today around having an integrated network of support for individuals who are trying to break down barriers and achieve financial stability and independence. And really, when you look at all that, it's all social determinants of health for so many reasons, really. And so that plays right into what Dr. Foreman-Hayes and Dr. Woodard were talking about in terms of making sure we're all having a coordinated network of care. And it's not just about healthcare, right? It's about all of these other things. It's about food stability, housing, job training, upskilling. And when you think about the average Houstonian who wants to find a way to help, there are absolutely some things you can do. You can still volunteer. There are still virtual things you can do to help, either your favorite nonprofit or reaching out through United Way and working with many of our partner agencies. As I think is probably obvious from this discussion so far today, some of these challenges must have policy solutions. And so, part of that's getting engaged politically, if you can, and if you're comfortable doing so, and just really thinking about what can I do to help support what our community needs to support each other and provide a more stable foundation of success for the citizens across the greater Houston area. And again, obviously, one of the things we always see in Houston is that in times of disaster, which is what we're in the middle of right now, it's a different kind of disaster than we're used to dealing with, but it is still a disaster. Houstonians are some of the most generous people I've ever encountered in my life. And earlier this year, we were able to partner with the Greater Houston Community Foundation on the Greater Houston COVID-19 Recovery Fund. We were able to raise $17 million that we immediately distributed back out to trusted partners who were able to provide immediate need to the most vulnerable people in our community here who really needed help. And we've been so grateful for the support of the City of Houston and Harris County and other local government programs, and really being thoughtful and proactive around providing rental assistance childcare scholarships, really trying to bolster the foundation of what we're all trying to struggle through right now. So I do think there are plenty of ways to give, there are plenty of ways to volunteer, and there are plenty of ways to get engaged and just think about from a policy perspective what else we can be doing to expand the network of support we can provide for each other.
Yeah, those are terrific stories, and truly one of the few silver linings that we can find is the hardiness and the spiritedness of people to pull together through this. It's been extraordinary. But sticking on the question of policy, Dr. Woodard, how do we think creatively here?
Well, I think the most sort of creative way that we can contribute to the issues around policy is, as Amanda mentioned, to get involved, to educate ourselves, to understand the implications of policies, and to get involved and make a difference. And one of the biggest things that I think is we're facing right now as we think about the increasing number of uninsured is ensuring that the protections that are in place from the Affordable Care Act remain in place, so that individuals who don't have employer-based insurance will still have an opportunity to acquire health insurance. I mean, and even that is unattainable for some, but certainly better than if we didn't have that in place. And I think importantly, back to your point earlier, we have to think about how we disentangle health insurance from employment, because when we see something like the COVID-19 pandemic, we see more and more individuals who've lost their jobs and as a result have lost their insurance, making access to care even more difficult for them. And then I think we think creatively about other ways to offer healthcare to our community. So there are unique models that we can think of, like direct primary care models. So the University of Houston is working on such a model where individuals are able to work directly with providers to pay for care that covers most of their primary and preventive care services directly. And so I think that those sorts of models can help us to be more innovative and think about how we meet the challenges that our communities face.
Yeah, terrific points. Dr. Foreman-Hayes, another question coming out of the chat. How do we reduce the number of uninsured in Houston? What are the public policy approaches here?
I think everybody knows what I'm going to say. That's Medicaid expansion. I do agree with everything that Dr. Woodard and Amanda have said. I think being creative and working together, we certainly have, as the city of Houston, called on all of our partners throughout this pandemic, and we are good collaborators because we know that we don't have the resources as a city entity to do all things and to do all things well. So collaboration is something that we are counting on everyone on this event today to be a part of and continue to work with us on. But I would say that from a policy point of view, I think Medicaid expansion is something that we kind of are suffering from, we have been suffering from since Texas didn't, choose to do that. Which has forced us to be creative in getting, health care and services to those folks who don't even benefit from ACA. And I think Dr. Woodard made an excellent point about that. Even with affordable care, which we need to make sure we maintain, we still have some folks that are, go to work every day and they work full-time jobs and they have no benefits. That's unacceptable. That's unacceptable for a person to earn such a low wage that they can't even qualify for even some of the public policies, public programs and benefits that we have. So I think if we are able to do a better job at expanding the availability of benefits, at least people will then have an avenue in, and then with that avenue into our system, we can educate on how to utilize those benefits, because that's another important piece. Just because you have access to care doesn't mean you know how to use it. And we saw this when Affordable Care first came out. We had to, as a health department, go out and then educate the community who were now eligible to say, okay, you don't have to wait now to go to the doctor when you're sick. You can actually go and get a preventative exam. So there's lots that has to be done, but I think Medicaid expansion is one way to do that.
Right. Dr. Ali Khan, given that that's the reality today, in Houston. Can you describe a couple of models or methods that are being used in the provider space to reduce the cost and burden of healthcare?
Thank you, Edmund. So multiple different things. And as I was hearing Dr. Woodward as well as Dr. Foreman Hayes, I think that our role as a large health system is to really be able to work and partner with you guys, to be able to really, how do we, because our facilities are within the communities, in Conroe, Kingwood, and as multiple different areas throughout Houston where there are a lot of disparities, and we want to be able to address them. And we want to be able to impact change and impact, policy if we can. And to be able to, with University of Houston and that relationship that we have, and to be able to train students within our facilities, within our hospitals, and get them into primary care areas, the outpatient clinics, with our GME residents, to make sure that they get trained in the communities. We're trying to build, and we're assessing facilities to be within the community that will be able to provide primary care, and to really treat the communities for those chronic diseases, assess the social determinants of health, and really tackle the real problems, because this is not going away. And I think with COVID, it made it even more dramatic. So I think out of the pandemic, and particularly out of this conversation, I really want to make sure we develop stronger bonds as we deliver care to each of our, to the community and at large here in Houston.
Mm-hmm. That really is one of the themes that's threaded throughout the report and this conversation, is the necessity for us to come together as a community to solve these issues. One of the things that the report really highlighted was the role of technology in healthcare. And, it's changing rapidly. We've seen whole new methods and models of care evolve through the COVID pandemic. And I wanted just to, ask each of you guys for a couple of thoughts as to what you think are the most important or the most impactful changes in technology, over the next sort of let's say the 5-year horizon. Dr. Woodward, what's your perspective?
So for me, I think one of the opportunities that we've seen come out of COVID is the ability to think about how we deliver healthcare in a variety of ways that may have been less traditional pre-pandemic. And so, of course, telehealth has been a big advancement that we've seen during COVID-19. And what we've seen is individuals being able to access care in a way that's more efficient for them, from places that allow them not to have to leave their jobs and come in to see us. And so it's made care more convenient. And so one of the things I think that is that we continue, as we've talked about here, building on these different partnerships that we have. For example, our learners going to HCA and being able to train them how to effectively work and use technology to the benefit of their patients. One of the things I will highlight, though, is while technology has tremendous promise, we've talked a lot here about communities that have been disproportionately impacted by COVID-19. And I think it's important for us to remember, as we expand to use more technology as a means to deliver healthcare, that we don't forget about those communities who may have less access to technology. And so I think it's very important that as we continue to advance the way we deliver care, that we always keep at the forefront communities that have been underserved and traditionally disadvantaged, and where the healthcare system has not traditionally met their needs, to make sure that we don't further exacerbate disparities when we think about the use of technology.
That's an extremely strong point. It was a topic of conversation a while ago, the notion of the digital divide. And, this continues to reverberate in different ways. Amanda, what's your, from your perspective, focusing on technology, what do you think is the biggest change that we're likely to see with the intersection of technology and healthcare over the next 5 years?
A couple things, and just to echo Dr. Woodward's comments, I could just say amen to everything you just said, but there are simple things that, and I know they haven't been simple to deploy, but it's amazing how quickly we can pivot when we need to. Telehealth, for people who are working really hard, struggling to make ends meet every month, the fact that someone doesn't have to worry about missing work effectively to make an appointment, can get on efficiently and have that appointment, I think that does, on the one hand, it increases access. Dr. Woodard's spot on with the digital divide, depending on their access to technology. But again, I think people can be compliant with appointments, they can do those things. But looking forward, and again, it just goes to this collaboration point, and I think just the tremendous need for our community to come together in a way that is probably unprecedented ultimately. I think from a technology perspective, we've got huge potential for community information exchanges, community resource exchanges, warm referrals, where we can really provide an integrated network of care and support where, if we have somebody who calls 211 and has a need, we can connect them not just through our own referral process, but connect them to the community, and then have a means through which we can track those client journeys, we can do warm referrals, we can make sure individuals are getting the care they need, and then, from our strategic perspective, make sure they're getting a complete suite of care. They're not just addressing an acute medical issue, they're also getting the income they can get with their skill set, or we have an opportunity to upskill them so they can get a better paying job with better insurance. They can make sure that their children have access to quality, affordable health care and out of school programs, that people who have been suffering from the increased domestic violence we've seen throughout COVID have more immediate and better access to the resources they need to stabilize the lives of themselves and their family and move on. So for me, I think the great promise of all this, COVID has laid so many inequalities so bare. It's also highlighted just how strong and urgent the need is for us all to come together in a different and new kind of way. So I think the potential for us to really leapfrog forward on this is huge at this point.
Mm-hmm. It's a topic I'm going to return to in a moment, the notion of collaboration and how technology can enable us to forge those bridges in ways that were not possible just even a short while ago. But Dr. Ali Khan, technology within the provider space, I know you're a visionary in this space. What do you see in the next few years being the primary changes or advantages that technology will bring in healthcare?
Going back to COVID, with regards to how we, had to rapidly implement telemedicine solutions, how we had to be able to interact with patients and, be able to assess them, almost, remotely with regards to, them being able to do the screening questions, to be able to, prevent them unnecessarily to come to the hospital. So we've rapidly had to understand how do we deploy telemedicine technologies, and how do we leverage that to be able to improve lines of communication, prevent unnecessary admissions, and to be able to get that second point of the report, improving access, getting access into communities that don't have primary care facilities or primary access points, and utilizing those interfaces to be able to get patients the information in a rapid fashion, and to be able to partner with different types of primary care groups, as well as local health departments, to be able to communicate, educate our communities about chronic diseases such as diabetes or high blood pressure, heart disease, so they don't, so they know where to access care, how to, to be able to understand how healthcare works, and then if they do make it into the hospital, what things are we doing in order for them to be able to leverage the new technologies that we have to improve their own care. So some of the things that we've done, in order, once they do get discharged, we have that follow-up, a bot that shows up on their phone and asks them, are you still having symptoms? Or being able to report and kind of guiding them what they need to do and how to access further levels of care. So we are still figuring these things out and working with our HCA national enterprise to be able to, leverage lessons learned from other divisions. We are a sisterhood of about 184 hospitals. What have they done in their areas to be able to bring that technology, bring those resources, bring that information and cross-pollinate best practices to bring it into Houston and to deliver better care?
Thank you. let's pivot for a second. Dr. Foreman-Hayes, we haven't really discussed much on the economic role of healthcare in Houston. From your perspective, what are the things that can be done to continue to secure, the importance and the role of healthcare in the Houston economy?
Well, I think that the great video with Stephen in the beginning talked about just the importance of healthcare to the city of Houston. I mean, my office, if we look out the window, I'm blessed to be able to look over the Texas Medical Center with, probably over 50 institutions. I used to know the exact number, but we're growing and growing. So I think that we certainly need to make sure we're bringing in, the best and the brightest from a workforce development point of view. We are also concerned about that and focusing on that as a public health department. So we want to make sure that we're bringing in the brightest. We want to have a public health workforce that can address the issues that we're facing that are emerging, as well as be able to utilize and develop new technologies, even within public health, because we've had to utilize new technologies to address what we're experiencing now. So I think that Houston's economy, and as a city, we need to be able to attract the best and the brightest as far as a healthcare workforce. And, when people move to Houston, they contribute to Houston's tax base. They make Houston better. So certainly healthcare is a huge part and should be a huge part of Houston's economy. Public, active. That's my view. I'm not sure if anybody else wants to add, but certainly we know healthcare in Houston is, and of course, being in healthcare is just as important as oil and energy. And I think the report kind of highlighted some of the, I guess, not necessarily disparities, but certainly some of the numbers.
The key things that's been raised up is the dynamics in the labor market. The shortage of RNs, the shortage of physicians, the shortage of other skilled clinical workers. Dr. Woodard, coming from a medical school, what are the dynamics and what's Houston's role to play here?
Well, I think one of the really important things is for us as a very diverse community to think about that workforce development, and to not only think about it as far as numbers, but to think about it as far as who is represented, right? We know that when communities of color get care from physicians and other healthcare providers that look like them, they have better outcomes. And so I think it's important, as we think about workforce development, that we're thinking about a diverse workforce that reflects the communities that they will serve. And so again, I would just highlight those issues around pipeline and workforce development. And I would also, when we're talking about the economy, we focus a lot on our healthcare sector, and certainly there have been challenges with regard to COVID. Even though we're in the midst of the largest healthcare crisis that any of us have seen, our healthcare industry has still suffered. But I think it's also important to remember the individuals in the communities, because we can't have a healthy economy if we don't have healthy communities. And so I think that those are the real lessons that I've seen come out of COVID-19.
That's right. And as COVID changes the labor and the employment landscape in Houston, people are changing the roles that they have. Amanda, from a public sector perspective, how do people or how does Houston react to that in terms of upskilling or reskilling people? What are your thoughts?
It's a great question. And one of the things I was thinking about as Dr. Woodard was talking is when you think about the different significant sectors of our economy right now, obviously one of those sectors that's facing a lot of pressure is the energy sector, given the knock-on impact of COVID and reduced commodity prices. And when you think about our broader population and the fact that between 40 and 50% of families are working hard and still having a hard time making ends meet, one of the best things we can do to help that community is providing upskilling, additional job training, certification programs. So I do think, to the extent that the energy sector in particular continues to face pressure, people will be looking to healthcare as a place for those employment opportunities. And I think that's something we need to keep in mind. And I think the healthcare sector can afford a lot of those opportunities. When I see some of the clients we've had go through our Thrive, a financial stability program, the healthcare sector is is one of the places they turn to really achieve new skills and find financial stability through the jobs they're able to get in that space. We've been able to do that with energy, but if there's continued pressure in that sector, I think there'll be some job growth in terms of different types of transition we can make in that sector, but I do think people will be increasingly looking to healthcare as a source for employment.
It's absolutely right. So we're closing on some of the last questions here, integrating some from the chat as well. A theme that's emerged both in our conversation as well and the questions is the need to collaborate, and given the complexity and the broad spread of the issues that we're facing. Dr. Ali Khan, do you have some examples of learning from COVID? What collaborations sprung up from COVID, and how can we leverage them moving forward?
So in the early part of the pandemic, this was, like we said, this was a whole new experience for every one of us. How do we even approach it? How do we assess how bad it is? And what processes do we put into place? So early on in the pandemic, we actually have been talking to our sister health systems here in Houston to be able to, we were meeting at a nightly basis to assess what they're seeing in their facilities and how do we collaborate with one another. We developed a leveling document, level 1, 2, and 3, in assessing what we need to do with regards to hospital visitation or PPE, or how are we going to impact patients who are in the hospital. How do we cordon them off or keep certain areas for patients who are COVID positives. So we had to learn a lot of, infection prevention, infection control, that we were getting guidance from, health, from CDC, as well as within our own enterprise of HCA, and then rapidly implementing. And then we shared it. We shared it with all of the other health systems, and we collaborated. We took some of their best practices. They took some of our best practices, and it allowed for a great cross-pollination to be able to make sure that we were uniform in how we were, preventing further infection, protecting our workforce from getting infected, as well as continuing the highest level of care. And then Dr. Septimus, who is part of Memorial Health, Memorial Hermann System, but also as part of HCA, does a daily COVID brief. He shares that information, latest knowledge, and then we share that amongst one another. And any new trials that are coming out, any new drugs that are coming out that might be beneficial. What is your experience? And so it allowed for us to kind of put down that guard of competitiveness and say, how do we collaborate and really advance patient care?
Mm-hmm. And that's the key is communications. I'll ask you, Dr. Foreman-Hayes, what are the forums by which public and private sector can come together to start to address this? What exists today? What should we be building for tomorrow?
Well, certainly, I think collaboration is the key. From a public health point of view, we know that we can do very little without our partners. And so I think the mayor has done a good job at putting together, entities like the HER Task Force and Complete Communities. I think these are great efforts for the Houston community to be able to get multi-sectoral partners around the table that can put real resources and really contribute to making some significant changes in Houston. So I can think of two right there. Of course, there are other, we're all a part of, because of what we do, so many different task force and so many different councils, and we can be meeting out. But I think some of these task force that we're already working on, it's no need to reinvent the wheel. We just need to put forth the resources, the effort, and really commit to make real changes. And I want to add one thing. Oftentimes, because we're as a health department, we're so steeped right now, and we completely pivoted to a COVID response. I often hear people say, "Oh, I'm so looking forward to when we can get back to the way things were." And in my mind, I'm always saying, I hope not. I hope that we do not go back to working in silos and working as individuals. And I do hope that we do learn what we've learned from COVID to move forward and move our city forward by using all of these new efficacious kind of ways that we can get things done that we didn't know we could do it this way until COVID forced us to do it this way. So I think that collaboration is key, and it's going to take public and private partnership.
Those are just tremendous points. The way things were before, there's strong points and weak points, and we've learned a lot. And moving into a new reality, a new future is the key. One of the things that is troubling me at the moment is that people are scared to get back into a healthcare setting in some cases. We saw some of these cases where people are delaying and deferring care. Amanda, what are your thoughts, from your perspective? How do we encourage people, give them confidence to return to the healthcare sector?
That's a great question, and for some of that, I'll defer to my far more qualified colleagues on some of that. But I do think from a social services sector, from a nonprofit perspective, there are some things we can do. And again, just echoing Dr. Foreman-Heath's comments, there's so much collaboration that's been done this year in the heat of this crisis. We have to be able to preserve that going forward. And so I think some of that is, checking our institutional egos and our baggage at the door a little bit. And I'm hoping we can preserve that dynamic going forward. But in terms of getting people comfortable, part of it is leaders modeling behavior. Part of it is for the systems we utilize to coordinate care, making sure we're communicating effectively about the safety of that care. I think a lot of the panels that have been going on across the community for the last several months, where you've had the heads of health systems, you've had your talented professionals here today communicating around that. I think all of that helps. On the referral side for 211, I think we have a role to play there too. But I think there are a lot of things we can do. I think so much of it just boils down to communication, and then just showing through data that the protocols and protections everyone's put in place are working and effective and safe.
So I want to thank everybody for the time, the thoughts, and the input today. The crisis, COVID-19, really did, as we've discussed, highlight some disparities and weaknesses, but it's also shown us the opportunities to collaborate and to come together as a community. And if we can use that energy moving forward, the sky is the limit. So again, I want to thank all of the panelists for your time today. Thank everybody on the chat for the questions and for everybody listening. And with that, I'll turn it back to Brett. Thank you so much, everybody.
Well, Dr. Jackson, thank you for an amazing discussion. And panelists, that was just really great. And hopefully this will be not the end, but the start of the collaboration that we've all been talking about. So on behalf of the Center for Houston's Future, I'd like to thank all of you for listening today. I'd like to thank the panelists, and most importantly, I'd like to thank our sponsor, HCA Houston Healthcare, for their generosity in underwriting this work today. If you're interested in receiving a copy of a report, we'd be happy to mail you a hard copy if you just fill out the address on our website on the registration page. You can also download the report at futurehouston.org. We'll also be around to respond to your questions in the chat. So feel free to keep the dialogue going. And thank you so much for attending. We look forward to continuing to work with you on this issue. And thank you for being with us today. Take care. Bye now.